Good evening and welcome to Just the News. My name is Faye. This is where you'll get the day's events without any shouting or any drama, and this bulletin is completely void of any opinions whatsoever. Let's get straight to it. Bharat Biotech, the manufacturer of Covaxin, has said that the full data of its phase 3 trials will be made public in July this year, according to a report on ANI. The data will be first submitted to the Central Drug Standard Control Organization of India, followed by peer-reviewed journals with a timeline of 3 months for publication. Bharat Biotech has told ANI that once the final analysis of phase 3 data is available, it will apply for full license for Covaxin. Bharat Biotech had earlier said that Covaxin demonstrated an overall interim clinical efficacy of 78% and 100% efficacy against severe COVID disease in its phase 3 trials. The interim analysis was based on more than 87 symptomatic COVID cases. But the data had not been made public for anyone to examine, and it had not been peer-reviewed in any medical journal. WHO also has not added this vaccine to its list of recognized vaccines, which is now causing a problem, we understand, for those, for example, students who hope to join American universities in this term. They've been asked to take one of the vaccines that have been recognized by WHO. According to a study by the Indian Council of Medical Research and by Bharat Biotech, the two of which had developed this vaccine, Covaxin offers protection against both the beta and the delta variants of COVID. The delta variant of COVID, which is B16172, is the one that originated in India, and the beta variant, which is B1351, originated in South Africa. India has reported less than 1 lakh COVID cases for the second day in a row, 92,596 new cases altogether, 2,219 deaths reported in the last 24 hours. The death numbers still are very worrying. Tamil Nadu, Kerala and Maharashtra reported the highest number of cases. Daily infections remained low and below 1 lakh for the second straight day. According to the Union Health Ministry, daily positivity rate was recorded at 4.67%. It's been less than 10% now for 16 consecutive days. The central government has released its policy on pricing of vaccines in private hospitals starting the 21st of June when the new policy kicks in. Remember, for public hospitals and for government-run vaccine drives, it's completely free for everybody. But if you choose to go to a private hospital, these hospitals are allowed to charge what they're paying the manufacturer plus GST plus 150 rupees as service charge. So that means that the Serum Institute of India's Covishield will cost 600 per dose plus GST of 30 rupees and a service charge of 150 rupees, taking it up to 780 rupees per dose. Similarly, by similar calculations, Bharat Biotech's Covaxin will cost 1,410 rupees and Russia's Sputnik 5 will cost 1,145 rupees. Of course, government hospitals and government vaccination centers, it will be completely free. This is starting the 21st of June. Now, following that government's announcement of vaccine policy, Fortis Healthcare has said the 150 rupee cap on the service charge does not cover all of its costs. According to a report in ANI, a statement by Fortis Hospital said, and I quote, "We urge the government to reconsider the higher charge of the off-site vaccination camps to enable expanded coverage, as the cap of service charge of 150 rupees does not cover additional costs incurred for off-site vaccination camps, which involve ambulance transport, doctors and other costs." So this is about camps that happen outside of hospitals, in building societies and other neighborhoods, for example. In response to the administration charge from Apollo Hospitals, the Joint Managing Director, Dr. Sangeeta Reddy, in an interview with CNBC TV18 said, "It doesn't make a very big difference to us. We were approximately charging 200 rupees per dose. The Prime Minister has said 150. We will continue with our vaccination program." The Karnataka High Court has observed that an estimated 20% of students studying in government schools in the state do not have access to any gadget or television to study online. The court has raised concerns on how girls in rural villages are being married off early because they're no longer in school and they face the threat of child trafficking as well. The court has said it's the state government's obligation to provide access to education through technology during COVID. It said, and I quote, "If such steps are not taken for these children by the state, the state would fail on its part of ensuring the fundamental rights of such children under Article 21A of the Constitution and also the right of the child to be educated. End quote. According to an affidavit filed by the National Commission for Protection of Child Rights, or the NCPCR, before the Supreme Court, from April last year to June 5th this year, 3,621 children have been orphaned in India. 26,176 children have lost one parent, and 274 have been abandoned altogether. The NCPCR has clarified that in these cases, some of the parents died because of COVID and some for other reasons. Of these numbers, 11,815 children were in the age group of 8 to 13, and 5,107 children are in the age group of 4 to 7. Maharashtra has been the worst affected, with 7,084 children, followed by Uttar Pradesh, Rajasthan, and Haryana. The Assam Education Minister has said this state will conduct its Class 10 and 12 examinations. He has also said that students will be given a choice of the papers and they will not have to take all the exams. Apart from the pandemic, the state also faces severe floods this time of year. The minister has said that we've identified enough examination centers outside flood-prone zones where exams can be held seamlessly. Also, the cases of COVID are decreasing in the state, so we are hopeful, end quote. The examination process will be over by the 15th of August, and the Education Minister has assured all examiners and staff members will be vaccinated. This comes after CBSE of the central government and several other states announced that they will cancel the 10th and the 12th standard examinations because of the pandemic. Assam has reported 3,948 cases, 43 deaths in the last 24 hours. Now, while the minister has pointed out that examiners and staff members will be vaccinated, we must remember that children are not being vaccinated right now, and so there's no protection for them just yet. Well, on to news now from the world of business and economy. Petrol and diesel prices hit a record high again today as fuel prices were raised one more time. In Delhi, petrol will now cost 95 rupees and 56 paise. Diesel is at 86 rupees and 47 paise. Mumbai, petrol is at 101 rupees and 76 paise per litre. Diesel is at 93 rupees and 85 paise. The highest price of petrol in India is in Rajasthan's Sri Ganganagar district, which is at 106 rupees and 64 paise per litre. But this news will get worse because the price of crude across the world is likely to go up even further. Now, Brent crude for the first time in 2 years crossed $72 per barrel. It was $24 a barrel in April last year because the entire world was in lockdown and the demand for fuel had gone down. It has since then climbed back up again because the world is now opening up. It's expected to go up even further. Some estimates have said it might go up by another 30%. Over the last 2 months, the price is up nearly 75% year to date, and it's likely to go up even further. Now, to remind you, when the price was down to $20 a barrel, round about $24 a barrel in April last year, that benefit was not passed on to Indian citizens. The margin or the difference was actually soaked up by the central government that increased taxes by 13 rupees per litre to make up that difference. Since then, the base price has gone up, but the tax remains the same. So even though it is right to say that the price is going up because global prices are going up, there is a possibility on humanitarian grounds for the government to reduce its tax in order to bring down the prices for Indian citizens. The World Bank, in the meantime, has cut its estimate for India's GDP growth this financial year from what was 10.1% down to 8.3%. According to the World Bank, India's recovery is being hampered by what it calls the largest outbreak of any country since the beginning of the pandemic. Now, the World Bank had, in fact, when it first gave out this forecast of 10%, warned that if there is a second wave, it will affect our economic growth. It has also projected that in the calendar year of 2022, India will grow 7.5%, and in the calendar year of 2023, 6.5%. But this comes on the back of bad news. We've had bad growth for some years now. In 2019, we grew only 4%. In 2020, we had negative growth of 7.3%. Now, the World Bank has said that activity will benefit from policy support, which means decisions made by the government, higher spending on infrastructure, rural development, health, and stronger than expected recovery in services and manufacturing. So effectively, it is saying that the Indian government needs to announce stimulus packages and spend a lot of money building things, developing healthcare in order for our economy to bounce back. Well, according to Reuters, the World Bank president has said the bank does not support waiving of intellectual property rights for COVID vaccines, as it would hamper innovations in the pharmaceutical sector. Now, to give you context, the US, New Zealand, France, and Russia all supported waiving of intellectual property rights for COVID vaccines. This was a move initially proposed by India and South Africa. What it basically means is that when one company develops a vaccine that gets approved, it owns the IP or the recipe to make that vaccine. Waiving of those rights means that anybody across the world who has the recipe and the necessary raw materials and the approvals of their respective governments can begin to make the vaccine as well. This would mean that developing countries will have larger access to vaccines, that supply will increase and prices will come down. Germany had refused to support it for the same reason, saying that if this is done, it will disincentivize innovation and R&D within the pharmaceutical sector. Now, the World Bank has supported that stand as well. Moving on now to news coming in from across the world. El Salvador has become the first country in the world to adopt Bitcoin as legal tender, according to CNBC. The law was passed by majority in the country, receiving 62 out of the 84 votes. Now, the law effectively reads that the purpose of this law is to regulate Bitcoin as an unrestricted legal tender with liberating power, unlimited in any transaction, and to any title, public or private. So this means that now prices can be shown of Bitcoin in the country, tax contributions can be paid with Bitcoin, and exchanges in Bitcoin will not be subject to capital gains tax within El Salvador. Nigeria has announced a ban on Twitter on Friday after authorities accused the platform of threatening the country's corporate existence by allowing misinformation and fake news to spread. Several Nigerians and local human rights activists have filed a lawsuit seeking a lift on the government's ban on Twitter. They said the decision to suspend the platform's operation was an attempt to silence criticism of the government. Twitter has said the ban is deeply concerning. Meanwhile, former US President Donald Trump has praised the move. He also urged other countries to ban Twitter and Facebook for not allowing free and open speech. Well, news coming in from the world of sports right now. Sunil Chhetri has surpassed Lionel Messi to become the second highest active international goal scorer with 74 goals. Now, he achieved this feat during the World Cup qualifier game against Bangladesh. Cristiano Ronaldo is the first highest scorer with 103. UAE's Ali Maktouk has come in at number 3 with 73 goals, and Lionel Messi is at number 4 with 72 goals. India will next face Afghanistan in the World Cup qualifiers on the 15th of June. And a piece of positive news before we leave you for today. Delhi-based lawyer Sharon Mathew has started a website called covidrightsindia.com, where people can reach out to lawyers for pro bono advice on legal issues arising out of COVID and find information related to their rights. Now, it helps women who are suffering domestic abuse cases, it deals with medical negligence, and several other things. On the website, you'll also find various orders by Supreme Court, High Court, and ministries organized in a state-wise manner that are relevant to you. It has been done to provide easy access and streamlined flow of information. It also aims to increase awareness among the masses about their rights during COVID. You can check out that website. The description is website is in the description of this video on our YouTube page. That brings us to the end of the news. Thank you so much for listening. Do give us a thumbs up if you're still finding this useful. And if there's anything else that we can do, some other kind of information that you think will be useful for you at this point, let us know. And we would love to hear from you and improve this broadcast in order to be of greater service to you. Thank you so much for watching. Good night.